A heart attack is also referred to as a myocardial infarction. Your heart muscle needs oxygen to survive, and that oxygen is brought to the heart muscle in blood flow. When a heart attack occurs, that blood flow that carries the oxygen is either severely reduced or completely cut off, starving your heart of the oxygen it needs to properly function. When the heart muscle is deprived of the blood flow and the oxygen, injury to the heart muscle occurs. The amount of damage to the heart is determined by what area of the heart no longer has that supply of oxygen, as well as the length of time between the onset of injury and seeking medical treatment.
So who is at risk for actually developing a heart attack? The population who are at greater risk for developing a heart attack often have one of the following risk factors from these next couple slides. So if you have diabetes, that can increase your heart attack due to the rise in glucose and sugar levels. And then high blood pressure causes extreme damage to your arteries, which can lead to a heart attack due to that high pressure. Overweight and obesity is just accumulation of the high cholesterol, blood pressure, diabetes, which all lead to risks of heart attack. And then you have smoking, which causes vasoconstriction, which decreases that blood flow, increasing your risk. And then you have the high blood cholesterol, specifically the LDLs, that low-density lipoprotein. This is often referred to as that bad cholesterol, which increases that plaque buildup, leading to that heart attack. So here are some more risks that potentially could lead to a heart attack, and they are the metabolic syndrome, which again is the accumulation of obesity, high blood pressure. And then you have the family history. You have sedentary lifestyle, so just being inactive. Stress, specifically that chronic stress, can put strain on your heart. Illicit drug use, and then any pre-existing conditions such as an autoimmune disease can lead to a heart attack.
It is important to recognize the major symptoms and warning signs seen with a heart attack. Heart attacks can be sudden and intense, or they could start slow with mild pain. Most people describe the feeling as a crushing feeling, pressure, squeezing, or pain in their chest. This discomfort is usually felt in the center or the left side of the chest and persists more than a few minutes. The discomfort or pain can radiate into the neck, the jaw, the back, shoulders, or arms. Some other symptoms typically associated with a heart attack include lightheaded, faint, or weak feeling, could possibly break out into a cold sweat, have nausea, vomiting, unexplained tiredness, or shortness of breath. Women and older adults' symptoms can vary. It has been found that some of the symptoms can be more subtle in women, making it confusing if they are actually experiencing symptoms of a heart attack and if they should seek help immediately. Due to the symptoms being more subtle in women, they have dismissed the symptoms with the belief that it's just the flu, acid reflux, or normal aging. Older adults, on the other hand, may not exhibit the typical pain associated with a heart attack and have often reported symptoms of difficulty breathing or possibly no symptoms at all. This can make recognizing the early signs of a heart attack very difficult. Older adults are encouraged to pay close attention to what they may believe is just weakness or normal pains that occur with aging.
So what causes a heart attack? Well, a heart attack is when one or more of your coronary arteries become blocked. And that blockage is from cholesterol, various substances that build up over time, and that's actually referred to as plaque. So the buildup of this plaque can cause that artery to become blocked and therefore leading to that heart attack. Now, once blocked, the oxygenated blood that's feeding that heart muscle cannot flow to those specific areas, and that deprived portion of that heart muscle actually dies. So this entire process leading up to the heart attack, that accumulation of plaque in your arteries, is referred to as atherosclerosis. The next slide looks at that a little bit more. So causes of atherosclerosis, which is the buildup of that plaque, can be caused by, again, that high blood pressure, high cholesterol, obesity, smoking, diabetes, family history, inactive lifestyles, that chronic stress, any pre-existing conditions, and drug use. All of these things increase your risk for that buildup of plaque in those arteries, which lead to a heart attack.
This next section will cover the diagnostics for myocardial infarction. These next two slides will examine testing that can be done to rule out or diagnose MI. The echocardiogram uses Doppler ultrasound to determine the velocity and the direction of the flow of blood in the heart. With this, ventricular function is evaluated and the ejection fraction can be determined. The next one is electrocardiogram. 12 leads are placed across the body that can be used to assess the electrical output of the heart. This is used to rule out or diagnose acute MI. T-wave inversion, zone of ischemia, ST segment elevation, zone of injury, and abnormal Q-wave, zone of infarction can also be viewed. The next item is the stress test. During this test, the heart is monitored by electrocardiography and images are taken of the heart by echocardiography during times of increased cardiac output or demand, such as running on a treadmill. This is used to identify areas of the heart that are at higher risk of infarction. The next exam is the angiogram. Administering an injection of iodine allows imagery of the heart to be taken, showing the flow of blood through arteries and veins. This can be used to determine if there are blockages in the heart, and with this information, we can confirm or rule out myocardial infarction. Another diagnostic tool is using lab values. Examining levels of proteins and enzymes in the patient's blood can assist in diagnosing myocardial infarction. The first value is troponin. A specific type of troponin is only found in myocardial cells. Elevated levels begin a few hours after myocardial injury and can last for up to 2 weeks. This is a reliable indicator of myocardial infarction. The next is CKMB. Of the 3 types of CK enzymes, CKMB is specific to the muscles in the heart. Levels increase after a few hours of injury and spike 24 hours after. The third value is myoglobulin. This protein assists transporting oxygen into muscle cells. While elevated levels cannot diagnose MI, it can be used to rule it out, as it's not specific to just cardiac muscle cells. So injury to other muscle cells can also lead to elevated levels of myoglobulin.
Hi, my name is Julio Gomez, and I will be talking to you about disease management and prevention of heart attacks. Now, when it comes to heart attacks, it is important to remember the old saying, an ounce of prevention is worth a pound of cure, meaning it is easier to stop a heart attack from happening in the first place than it is to repair the damage after it has happened. The heart is a strong muscle that is utilized in all other organs' functions. With this type of responsibility, it is important for us to consider heart health. Some risk factors cannot be controlled, those being age, family history, sex, ethnicity, and pre-existing heart conditions, and we call these non-modifiable risk factors. Although there are some things that are considered out of our control, there are some things we can do to reduce the risk of a heart attack. Modifiable risk management includes smoking cessation, physical exercise, healthier eating habits, controlling blood pressure with medication, and stress reduction. These heart-healthy options can optimize the health to improve overall health. Heart-healthy diets include the Mediterranean diet or the dietary approach to stop hypertension, otherwise known as the DASH diet. Both diets are rich in fruit, vegetables, nuts, beans, and seeds, along with low-fat and non-fat dairy, and includes whole grains, heart-healthy fats, and moderate amounts of fish, meat, and poultry. Emergency management of a heart attack can be a life-saving intervention, requiring swift action to minimize the damage to the heart. It is important to remember that heart damage is irreversible and can also dramatically alter a person's lifestyle even after just one heart attack. The first step when encountering a person experiencing a heart attack is to identify if the person is conscious or unconscious. Number 1, you should first shout and then shake the person if they are not responding. Number 2, call 911 and explain the emergency situation. Number 3, check for breathing. This is important because CPR is not necessary on a person breathing normally. Grunting or snorting attempts is not normal breathing. If breathing normally, rule hold them on their side. If they are not breathing, proceed to step 4. Step 4. Place your hand on the center of their chest. Step 5. Push hard and fast, about twice per second. Step 6. If you've had training, repeat cycle of 30 chest pushes and 2 rescue breaths. Once you start CPR, do not stop until help arrives, or another person can take your place and continue chest pushes. If you are experiencing a heart attack or suspect a heart attack, call 911 immediately. Take 324 milligrams of aspirin, preferably chewed. Aspirin is used to help dissolve blood clots that may be lodged in the heart. If nitroglycerin is prescribed, administer at this time. Nitroglycerin is used to reduce cardiac workload by dilating the arteries that supply blood to the heart. And remember, never leave a person experiencing a heart attack by themselves. There are many reasons why you should learn CPR, but here are 5 quick reasons why you should learn today. Number 1, it increases situational confidence. Whether in a crowded stadium or 20,000 feet in a jetliner, being faced with a medical emergency can be terrifying for anyone. In this case, a person that knows how to deal with a medical emergency because of the prior training will be better able to act on impulse and experience. Number 2, increases a person's chance of survival. Although it won't help your own odds of survival, you can help a person experiencing an acute episode thanks to this life-saving training. Number 3, save the life of someone you care about. If any reason to learn, this seems the most obvious. Did you know that 70% of sudden cardiac arrest happens at home? The need for life-saving CPR may be delegated to you in a family crisis. Number 4, you learn to use life-saving technology. BLS training now includes training on how to use a AED, automatic electronic defibrillator. AEDs are portable machines found in most public places and are used to deliver an electric shock through the chest to the heart to reestablish a normal heart rhythm. And number 5, it's easy to learn. If you are interested in scheduling a BLS certified CPR course, visit www.cpr.heart.org. Or if you are interested in learning more about the prevention of heart attacks, visit www.cdc.gov/heart-disease.
Hi, my name is Marco, and I am a student nurse. I wanted to let you know what resources are available in the community for patients wanting information on heart attack prevention and heart attack management after having a heart attack. The American Heart Association is a great resource for preventing and managing heart attacks, and anyone can access them via the internet. The American Heart Association is a non-profit organization in the United States that funds cardiovascular medical research, educates consumers on healthy living, and fosters appropriate cardiac care in an effort to reduce disability and deaths caused by cardiovascular disease and stroke. San Joaquin County has a program called PHASE, which stands for Preventing Heart Attacks and Strokes Every Day. It is a great resource for residents looking to get information about preventing and managing heart attacks.